You're very welcome. Thank you
Thank
so
you.
thank you so much for agreeing to come on today, especially on this Mental Health Awareness Week. I'm going to let you introduce yourself, Fiona, and tell the audience who you are and what you do within your role.
Thank you. Okay, so my name is Fiona Campbell, and I am one of the practitioners in the NSPCC Northern Ireland hub. We have two bases, one in Foyle and one in Belfast, and I'm based in the Belfast base. So my role is of lead practitioner for the Pregnancy in Mind service. So I'm really excited about being able to share information about that today.
Thank you, Fiona. So, why, of all the weeks, have you decided to come on and even give up your time and talk to us today? Why have you decided to come on?
Okay, well, I believe that talking about mental health is really important because by talking about it, I think it helps reduce misconceptions that maybe contribute to stigma. Talking about mental health may make it more acceptable for those that do experience mental illness, and it may assist them seek help, learn to cope, and to get on a road to recovery. I suppose it's important to remember that mental health isn't just about mental illness, it's about maintaining a positive state of well-being.
Brilliant, Fiona. That's so true. And it is about getting that balance and making sure everything's holistic in our lives to make us well. So you're very right there. So, what way does your organisation support women with their mental health?
Okay, so we support women through our Pregnancy in Mind service. Sometimes it's referred to as PIM, and it's a service for pregnant mums between 12 and 26 weeks gestation. And after a brief assessment that's generally carried out over the phone, 1 or 2 phone calls, we offer an 8-week group work program. So through that group work program, that gives the mums an opportunity to meet other people that are maybe feeling something similar to themselves. They might be feeling anxious about the pregnancy, or they may have experienced depression in the past. So the programme aims to meet the needs of those that are at risk of anxiety and or depression. More recently, we've introduced a postnatal element to the programme, which is really just 2 check-in calls after a few weeks after baby comes.
Brilliant. That is brilliant. And it's just knowing that and getting information out there, especially for our pregnant mummies in the audience.
Yes.
Yeah. So, what advice would you give to Fiona, a mummy who is struggling? They've maybe no diagnosis and it's maybe their first baby or whatever, and they're just struggling with their mental health and they don't know what to do or where to turn to. What advice would you give to them?
I'd encourage them to take a bit of space and time to talk. And I would be listening to really how they're feeling, which they can sometimes find that really helpful in itself. I'd encourage them to reach out if they're finding it difficult, to let them know that I or we are here, and when they're ready, we'll be here for them. I suppose sometimes feeling depressed or whatever can be lonely, and sometimes it's scary as well. And I suppose I would be wanting to remind them that mental health problems can be treated.
True, true. And it's very important that if you're struggling in the audience with your mental health, it's important that you do seek out and get help because it's equally as important as physical health.
Absolutely.
Thank you so much, Fiona. Is there anything else you want to add or to say to the mummies who are listening online?
I suppose sometimes it can be anxiety provoking, sometimes reaching out, but feedback that we have got from mums and or the partners that have gone through the programme is really positive, and they've built relationships, and some of those relationships have extended beyond the programme, with mums meeting up after their babies were born. So I would encourage any pregnant mum that is feeling anxious or a bit depressed, a bit down, to reach out and come to Pregnancy in Mind and give it a go.
Brilliant. So anyone can come and join this. And are they face-to-face or are they online, Fiona?
Currently, we're offering online, but if there are enough mums in the one area, say maybe 6 or 8, we are happy and would be really willing to offer the group in a face-to-face format.
That's brilliant. That's good to know as well. So online suits probably a lot of people if their work-life balance and they're trying to get other kids sorted or they're working. So that's brilliant.
Absolutely. I mean, we've had mums that have joined from their workplace. They've been able to get a confidential space, and for the hour and a half session, they've been able to participate. Whereas had it been face to face, they wouldn't have been able to avail of the service.
And that's great. They can connect as well with other mummies who are going through the same stuff.
Absolutely.
Brilliant. Thank you so much, Fiona, for your time.
My pleasure.
I really appreciate you taking time out of your busy week to promote this fabulous programme for our mummies here in the Southern Trust and all areas within Northern Ireland.
Indeed. It's been a pleasure.